The idea of this video came from a comment in which someone asked if insomnia can be related to physical problems or if it can be spiritual problems. It's a very interesting question which I'll attempt to answer through this video. Now, first of all, insomnia affects about 1 in every 3 people in the world, and about 10% are diagnosed with an insomnia disorder. And now there can be different psychiatric conditions that cause insomnia. There can be medical conditions that cause insomnia. But first, I'm going to talk about some of the lifestyle stuff, and I'll fit the spiritual in with the lifestyle. So it's just important to note that from a psychiatric perspective, whenever there's sleep problems or really any mental health symptoms, like problems with one's thoughts, one's emotions, whenever that stuff affects one's functioning in their daily life, like their ability to perform at work or at school or at the relationships, then it needs to be addressed through a clinician or a medical doctor. So if there's some other problems that are more subtle, which doesn't so much impact daily life, then it may be able to be taken up as almost like a spiritual approach. Another reason why I think it's important to look at the lifestyle or spiritual approach is because it's less likely to have major side effects. Medications can have side effects to the mind, to the body. The body can get used to it over time. As one ages, the medication just may not work the same, and so it can cause like increased risk of falls. Sometimes people can get dependent on certain medications, or they develop a tolerance where they need to keep increasing the dose for it to work. By any means, if there's ways to deal with it without medications, that oftentimes would be ideal. For most people without any medical or psychiatric or mental health condition, if they go to a doctor and they say they have trouble sleeping, the initial steps are going to be to recommend the sleep hygiene technique. So sleep hygiene, and there's this notion that you have to have healthy sleep patterns, healthy sleep behaviors in order to get the proper sleep at night. For example, it's mentioned for adults to get an average of 7 to 8 hours of sleep at night, while children may be able to function with more sleep and older adults may have less sleep. Go to bed at the same time every night and wake up at the same time every morning, leaving yourself about 7 to 8 hours of sleep at night. If you're in bed for 20 minutes or 30 minutes and just have trouble falling asleep, rather than tossing and turning all night and staying in your bed, get out of the bedroom, do something calming, and then go back to bed when tired. The bedroom should only be used for sleep or sexual activity. You don't want to be reading in the bedroom. You don't want to be watching TV in the bedroom. You don't want to take naps during the day. It's all just going to make it harder to sleep at night. And there's a lot of activities you can do during the day which might help to prepare for sleep. For example, if you exercise during the day, that might make you a little bit more tired. You want to try to limit late night caffeine, late night snacks, because that might just keep you up. You want to generally try to be up during the day and in bed or asleep at night because your body's circadian rhythm functions naturally in that way. Now, those are some of the most common techniques called sleep hygiene that a physician or a mental health provider may educate patients to try before trying a medication to help with sleep. Recommended to try sleep hygiene maybe for about a month and try to use it regularly for any medications to help with sleep. And that's assuming there's no medical or psychiatric causes doing it. Now, there's this question is insomnia related to a spiritual disease or a spiritual component to it? And so whenever I think of a spiritual component to illness or to problems, have to go through the source, which is the Holy Bible, and see what we can learn from what the Holy Bible says in regards to insomnia or trouble sleeping. And one example that comes to mind is David. David in Psalm 4, it's believed he's running away from Absalom, his son, who's trying to revolt and get his kingdom, even trying to kill David. This is a pretty scary time for David. He's basically running for his life. Someone kind of wants to take away his kingdom, take away even his life. And so how does David respond to this? So he really trusts God will protect him and God will save him. He prays to God. So David believes that because he's living a good life, like being kind to others, doing good for others, trying to serve God, do things that are pleasing to God, David shows in the psalm that he believes God will help protect him and help him sleep at night despite all the worries and troubles that are plaguing his life. So what David says in Psalm 4, verses 7 through 8, "You have put gladness in my heart, more than in the season that the grain and wine increased. I will both lie down in peace and sleep. For you alone, O Lord, make me dwell in safety." So despite the troubles that he's in, despite the problems in his life, the stress, the worries, the circumstances, he's able to be in peace and sleep. Now, a lot of times people might have racing thoughts, worries about how they're going to provide for their family, what's going on with their job, etc. But those could be good opportunities to really pray to God and to direct to God all that's going on. And God can help solve those problems, can help calm down the worries, calm down the mind. Another example in the Bible that explains this topic well is from the book of Proverbs, when King Solomon writes, "My son, let them not depart from your eyes. Keep sound wisdom and discretion, so there will be life to your soul and grace to your neck. Then you will walk safely in your way, and your foot will not stumble. When you lie down, you will not be afraid. Yes, you will lie down, and your sleep will be sweet." So King Solomon is essentially instructing, if you live a right moral life, like doing good and staying away from evil, that's going to help you sleep at night. It's going to help prevent one from having a guilty conscience that troubles them, that worries them, etc. Now, I think another example in the Bible of someone who says the prayers at night is Daniel. Daniel is one of the most gifted and wise men described in the Old Testament, who really was able to excel in his life because of his relationship with God. And it says in particular that he prayed 3 times a day, most likely in the morning, at noon, and at night. Also, another perspective is that the devil can try many ways to make people suffer, to make people go through challenges which they don't need to be. And so maybe one of those ways is that the devil can affect people's sleep, because if their sleep is affected, that may affect their mood. They may get grumpy. They may not be able to concentrate or focus. Another important aspect about prayer is this concept that it helps protect someone. So if the devil, in fact, is trying to get people to stop praying, to be worried, to get frustrated, to mess up their life, and it's through Christian faith that prayer, through the power of Christ, can help protect one from the tricks of the devil. It'll help bring someone comfort. It'll help bring them peace. It'll help them to be protected from the attempts of Satan to influence them negatively. And so there can be several lifestyle and spiritual components to insomnia, which are important to be addressed. The Orthodox faith often tries to address this. There's this Orthodox prayer book, which has these prayers at different parts of the day, morning, at night, throughout the day. And so it's often recommended to say some prayers, including some psalms in the Bible. It highlights gospel reading, and it says some supplications or requests to God. Personally, I find that when I do use this system of prayers, it does help me sleep better than if I did not pray, or even if I did a personal prayer that maybe didn't go as in depth. Now that I've gotten to share with you a little bit of what I think could help with a spiritual approach to insomnia, now I would like to switch gears to more psychiatric diagnosis or psychiatric conditions that can have sleep as a problem, that if treated could help one to sleep better. Because sometimes these psychiatric conditions, sometimes people can get family history of it, and if they have a family history of certain conditions, are more likely to develop it. Sometimes they've had a past where they've used drugs, or maybe had traumatic experiences which they weren't able to have the coping skills or deal well with. And so perhaps they have to take medications, function normally, or function to their optimal self. Psychiatric conditions that can cause problems sleeping, anxiety. I mentioned a little bit that if you have racing thoughts or worries, and you can pray to God about them, and he can help direct it. But sometimes in cases of anxiety, it can get excessive, or it can be difficult to control or calm down on one's own. And that can manifest as maybe difficulty falling asleep, or maybe even someone's waking up during the night because they have racing thoughts. And in those cases, it may be important to get medications, not for the sleep as much as to calm down the anxiety. And when the anxiety is calmed down, the sleep can improve. Other mental health conditions that has been shown to affect sleep is depression. Now, depression can vary between people differently. It essentially affects one's mood and their enjoyment of life. It can affect other symptoms like sleep. And sleep, they may find that they sleep more than normal. Like if they typically sleep 8 hours a day, they may go to 10 or 12 hours a day, or they sleep less. Oftentimes, one of the hallmarks of depression is people wake up early, like 2, 3, 4 a.m., and they cannot go back to sleep. And they also may find that their mood is worse in the morning, but gets better during that day. And so if someone suffers from a clinical depression, then in those cases, it's important to treat the depression typically with a combination of medications and psychotherapy. And through treating the depression, the sleep can get better. Other mental health conditions that have been associated with problems sleeping, post-traumatic stress disorder, not only can have problems sleeping, but there can be association with nightmares. Oftentimes, people may have scary dreams about the traumatic event that's going on in their life, and these dreams can affect people from sleeping comfortably. Even they may not recall the dreams, but maybe they have their spouse or partner say that they're waking up screaming or they're talking in their sleep, and that could also be that they're having these nightmares. Oftentimes, people may even wake up like sweating or feeling anxious and not recall their dreams, but they could be having these dreams that are affecting their sleep. I talk about a mini press, which is a medication often used to address those. Sometimes the most effective treatment for post-traumatic stress disorder is psychotherapy to help retrain how one is thinking about the situation. Another mental health condition that can really affect sleep is people that can get manic or hypomanic. In these conditions, people may get so much energy, they don't need to sleep. They have a lot of racing thoughts, doing activities. In those cases, probably they'll need medications like mood stabilizers or sleep agents to help calm down the mind, help calm down the body so that they can sleep and those hypomanic or manic episodes are resolved. There can be several medical conditions that can affect sleep as well. Oftentimes, people will complain of restless leg syndrome. There can be a culprit to restless leg syndrome, actually anemia, like having maybe low iron or a low blood count can affect restless legs, can affect sleep. So it may be important to get that checked from a medical doctor. Thyroid can affect activity levels. It can affect metabolism. It can affect sleep. So it's important to have the thyroid monitored. There's a lot of neurotransmitters involved with sleep. There's a lot of brain pathways that are involved. And sometimes there's a condition known as central sleep apnea, where people's brains or their spinal cord or that neural system is just not functioning properly. And for those cases, it often needs to be diagnosed through a sleep study, and they need to get a sleep study to see what's going on in their sleep. That may have its own set of treatment that can be leading to insomnia. There can also be another form of sleep apnea called obstructive sleep apnea. This is more commonly in people who are overweight or obese, or perhaps they have a large throat that basically closes down on their breathing tube when they're sleeping at night because gravity pulls it back. And these people might need a surgery, or they may need to lose weight, or they may need to have an oxygen mask to help with sleep. Sometimes people with obstructive sleep apnea, they may actually not only have insomnia, but may be associated with high blood pressure, maybe increase in their waist size, maybe cholesterol problems. So people who are at risk for those conditions may benefit from a sleep study to see if they're getting enough oxygen in their brain at night, because that can be a culprit to insomnia. There's many other conditions that can affect sleep. There can be sleepwalking, there can be night terrors, there can be side effects to medications. There can also be conditions when people work the night shift for long enough that their circadian rhythm changes, and they may have sleep problems as a result. There's also conditions such as narcolepsy, in which people sleep an excessive amount and they need maybe a stimulant or something to help them stay awake during the day. You kind of want to take all these into account when someone is suffering from insomnia. Super important to make sure the lifestyle and the spiritual life is on the right track, because you don't want to get unnecessary treatment or necessary medications if you can just adjust it with your lifestyle or your spiritual life, which would be much healthier in the long run. Sleep problems can lead to other conditions. It can lead to mental health problems. It may even lead to managing their stress levels differently, and stress over time can lead to medical complications. So it sort of can just be this exponential effect. So the better one is able to have sleep, be consistent with their sleep, I think it's overall going to be better for both their mental and psychological well-being. There are always some exceptions. 7 to 8 hours are just sort of the guidelines. Some people are able to function with less. Some people may need a little bit more. So there's this notion that there's 3 final frontiers in science. One is space, another is the deep ocean, and the other is the brain. There's just so much that we don't know about space, about the ocean, about our brains. And then just every day we're trying to do research and discover more and more. But ultimately, we don't know a lot of what goes on. So we do our best with what we do know. But thank you so much for the comment of asking if sleep could be either a spiritual or physical problem. As we can see, there's a good chance it can be related to either or perhaps both. I hope you liked watching this video.